Stress and health. This video will be covering these 6 topics. So what is stress? Stress is the physical, emotional, cognitive, and behavioral responses to events that are appraised as threatening or challenging. It can cause one to behave differently and affect one's mental condition. Stressors are what causes stress that come within a person from an external source and range from relatively mild to severe. The stress occurs when people experience unpleasant stressors, while eustress is the stress experienced when positive events require the body to adapt. Environmental stressors or factors include catastrophes, such as losing one's home in a hurricane or fire, which creates tremendous amounts of stress. Major life changes such as graduating or getting married. The SRRS measures the amount of stress in a person's life by adding up the life change units associated with each major life event. The CUSS has a list of rated stressful events that are most likely to happen to a college student. Hassle, or the bulk of stress we experience daily from little frustrations, delays, irritations, and similar small aggravations. The hassle scale is used to rate a particular item in terms of how much of a hassle it was. From 0 meaning no hassle to 3 being extremely hassle. There are 4 types of psychological factors or stressors. Pressure is when someone forces you to do the work faster than your usual pace, and controllability is when you're impossible to control or govern. Frustration is when you're blocked from achieving your goals or needs. And conflict, which has 5 types. Approach conflict, a choice between 2 positive choices. Avoidance, a choice between 2 negative choices. Approach avoidance, when you only have 1 conflict but it has a positive and a negative effect. Double and multiple approach avoidance is the same as approach avoidance, except it has 2 or more conflicts. Physiological factors. Endocrinologist Hans Selye studied the sequence of physiological reactions that the body goes through when adapting to a stressor. He called this the general adaptation syndrome, which has 3 stages. The first stage, alarm, is when the body first reacts to the stressor. The adrenal glands release hormones that increase heart rate, blood pressure, and the supply of blood sugar, resulting in the burst of energy. Second, resistance, when the body settles into sympathetic division activity. The early symptoms of alarm lessen and the person may feel better. Resistance will continue until the stressor ends. Lastly, exhaustion occurs when the body's resources have been depleted. Exhaustion can lead to formation of stress-related diseases or death if outside help is unavailable. Psychoneuroimmunology is a field that explains that the immune system is affected by stress. A breakdown in the immune system happens when we experience stress over prolonged periods of time. Some of the stress-related diseases that may form include heart disease. Stress puts people at a higher risk of coronary heart disease or the buildup of plaque in the arteries of the heart. Since the liver does not activate properly, this clogs the arteries, meaning that there is a possibility of heart attacks or strokes. Diabetes. Type 2 diabetes can respond favorably to proper diet, exercise, and weight loss, but may also require medication. Diabetes is associated with a higher risk of Alzheimer's disease. A study has found that high levels of stress in the workplace can accurately predict who will develop diabetes. Cancer. Stress declines the release of natural killer cells, cells that suppress viruses and destroys tumor cells, making the unchecked growth of cancer more likely. In addition, stress may also impact the effectiveness of cancer treatments. Other health issues include depression, HIV or AIDS, temporary blindness, asthma, Alzheimer's disease, and eating disorders. Now let's move on to the influence of cognition and personality on stress. Richard Lazarus developed a cognitive appraisal approach, or how a person will assess the degree of stress a stressor could give and how they will react to it using a two-step process. Let's go through the process using an exam as an example stressor. When the potential stressor occurs, primary appraisal begins, and you ask yourself, how threatening is this event to my well-being? If you studied well for the test, you'll consider it harmless or a challenge. In other words, it's an opportunity for you to do well, therefore, you'll have no stress. But if you didn't take good notes and you're not ready for the test, this is when you'll go through the secondary appraisal. You're going to weigh out your coping strategies. If you have adequate resources or adequate time to study for the test, then you'll use that time in order to cope with the stress. However, if you don't have enough resources or don't have enough time to study for the test, then you would either discover new ways to cope with the stress or remain stressed. Of course, personality has a lot to do with how one cognitively assesses a stressor. Therefore, Friedman and Rosenman wrote a book called Type A Behavior and Your Heart about the influence of certain personality characteristics on coronary heart disease. Let's talk about the 4 types of personalities. Type A people are described as workaholics. They're competitive, ambitious, easily annoyed, and hate to waste time. They're the type of people that will bring work to the beach instead of relaxing like Type B people, who are not that competitive but is easygoing, relaxed, and at peace. Studies and research have found that Type A people are more likely to develop a heart disease than Type B people. Researchers have found a link between having a Type A personality and having the presence of coronary heart disease. Hostility is a major factor of the Type A personality. In 1992, the Type C personality was added. Type C people are very pleasant and peaceful but find it difficult to express emotions, especially negative ones, so they tend to internalize anger. It has been associated with a high incidence of cancer. Lastly, Type H, or the hardy personality. They are the Type A people who thrive on stress rather than succumbing to it. They are less prone to heart disease because they have commitment and control, and instead of seeing it as a problem and avoiding it, they challenge it. A person's attitude to the things that happen to them is also a factor in stress. Optimists tend to live a longer life, have a 50% lower risk of premature death, and higher levels of immune system cells, natural killer cells, and anti-cancer cells, while pessimists have a higher death rate, problems with physical and emotional health, and less energy than optimists. Be an optimist because you're less likely to develop learned helplessness or become depressed, and you're more likely to care for one's health by preventive measures. Martin Seligman found that optimists tend to be more successful in life endeavors. Don't worry because it's a learned skill. You can do this by alternative thinking, relaxation, and correcting faulty thinking. Observe what you're saying to yourself and direct it to an optimistic point of view. Social factors that influence stress include poverty, job stress, or stress by workers due to the kind of job they have, the workplace environment, and the significance of their job in pursuing the meaning of life. And lastly, burnout, the negative changes in thoughts, emotions, and behavior as a result of prolonged stress or frustration. Acculturative stress, the stress resulting from the need to change and adopt to the dominant or majority culture. The methods on how people deal with acculturative stress, from lowest to highest stress, include integration, assimilation, separation, and marginalization. Social support is a network of friends, family, neighbors, coworkers, and others who can offer help to a person in need. Here are the 3 coping strategies for stress. The problem-focused coping strategy focuses on the action that would eliminate the stressor itself to relieve the stress. The emotion-focused coping strategy focuses on self-evaluation. Lastly, mediation and relaxation. Lastly, culture and religion can affect coping. Religion gives people a sense of belonging or membership. In addition, it gives meaning to things that others would deem meaningless. That's all. Relax and don't stress out too much.